Thanks, John. It's a real pleasure. This is a meeting that I had no idea what it was about when I got invited, but I'm glad I came because these are the kind of meetings you kind of really opens up your mind to different, assays, different ways of looking at the end result and whatnot. So I thank John for inviting me and Tom. I really appreciate the opportunity to present, and I promise, like I used to tell my graduate students, keep it sweet and simple and to the point, and I'm not going to belabor anything. So I am the founder and chief technology officer, or chief scientific officer, sorry, of HuMurine Technologies. So just a little bit of background, as John mentioned, we're a CRO, which is a contract research organization, and this came from my spin-off lab that I had at SUNY Upstate Medical University. My background in humanized mice go all the way back to the systemic days back in San Francisco. So we started this at UCLA as a model to look at HIV infection, pathogenesis, antiviral drug discovery and design. So back to 1992, when I was a postdoc at UCLA, then HuMurine was spun off in 2008. First as kind of an academic startup that was being subcontracting work to my academic lab. And then we went to the UC Davis Stem Cell Center in Sacramento at the UC Davis Medical Center and became the first industry partner with UC Davis. So it's my fourth UC campus now that I'm at. And I brought with me some of the staff that I trained as a professor in Syracuse. So we have very high level quality people that know what they're doing with the humanized mouse field. So a little bit different than what Brian and Barbara presented. I'm going to be presenting the taconic version of the NSG mouse, which is the NOG mouse. It's essentially the same mouse. The kinetics of humanization are very similar. And taconic provides the CIA mice to the United States. They have the license for it. We have a license to breed these mice because my feeling has always been that the best engraftment, most consistent engraftment model is the pup humanization model. And just recently, or about a couple of years ago, Taconic came out with the IL-3 hGM-CSF humanized human knock-in genes into the NOG background. And I can tell you the end result of this is I think this is a very preferred model for, especially for immuno-oncology. So we set out to actually comparatively look at the humanization dynamics of the NOG and the IL-3 hGM-CSF mouse. And this is basically our protocol. First of all, we prepare our own human stem cells, which is in contrast to both JAKs and Taconic. So we do a lot of QC in terms of the types of stem cells that we purify. We do colony assays to validate the totipotency of the stem cells. And we get our stem cells from human fetal liver. I know that's not preferable these days, but we still feel that in terms of the numbers, the logistics of humanizing large cohorts is really the only way to go. And financially, it's really the preferred method for us to economize the scale of this. So we purify our own human CD34s. We validate the cells before we humanize. And then what we did was take 10 to the 5th CD34s and then comparatively humanize NOG and the IL-3 hGM-CSF mice. And then we take, much like Barbara and Brian described, we take these mice, bleed them, and do multicolor FACS analysis to look at the humanization dynamics. So our mice, which we've branded Hu-M for the humanized NOG and the Hu-3GM for IL-3 hGM-CSF mouse, we do not only immuno-oncology, we've started doing a lot of different contracts for big pharmas and biotechs in infectious disease gene therapies using lentivirus vectors, looking at cytokine storm response, which a lot of companies are interested in, and in agents that promote hematopoiesis in the bone marrow. because the environment is much like a human bone marrow in these mice. But we have gotten into the immuno-oncology field, and again, the cut to the chase part is I think with the Hu3GM mouse is going to be the preferred model for these kind of studies. Just as an aside, we've also, it was mentioned about the avatar models. We've actually looked at the IL-3 hGM-CSF mice and actually can get avatars of AML from 14 ml blood draws from patients. And we can recapitulate that disease using stem cells from those blood draws into the neonates, IL-3 hGM-CSF neonates. And these avatars are responsive to cytarabine. We have that data, but I didn't bring it. But this is a very popular model that I think is going to take some traction pretty soon. The other system that we've been dealing with is much like our previous speakers have described, is the humanized immune system mouse engrafted with patient-derived xenografts. And again, much like this, what we're trying to do is make avatars, and we're actually semi-matching the HLA types of the stem cells and the PDX in these mice when we start this. So the way we're doing the comparative humanizations is we're only using about 10 to the 5th CD34s into these pups. And then we looked at comparative humanizations of NOG and human IL-3 hGM-CSF mice, and then look at 10 to 26 weeks, because one of the factors in evaluating some of these immuno-oncology agents is the timeline. You cannot lose the humanized graft in the time that you're treating these animals down the line. So they have to be pretty stable for 26, 30, 40 weeks without them losing the humanized graft. One of the issues with the NSGS mouse is that they lose the graft after a certain amount of time. So we decided to look at this, the IL-3 hGM-CSF, to see, first of all, what's the dynamics of humanization. And this is just a summary of our first run, black being the humanized NOG, red being the IL-3 hGM-CSF mouse. And then this is just looking at CD45 levels at 10, 13, 18, 26 weeks. And you can see that the IL-3 hGM-CSF mice are much more robust and much quicker to engraft than the NOG mice are. So we get about twofold higher levels of CD45s in the blood. More importantly, we get better monocyte development. So here is the number of CD14s in the blood at 10, 13, 18, 26 weeks. And again, you see about twofold increase in a monocyte macrophage development in these IL-3 hGM-CSF mice than you see in the NOG mouse. And this is just comparatively the graphs of human CD45s and the human monocytes in these. So you can see that the IL-3 hGM-CSF are much more robust, and they allow much better monocyte development. This is looking at T cells and B cells. There's total T cells, total B cells. One thing we've noticed is these mice have a little bit less T cell development levels comparatively to the NOG mice, and higher levels of B cells, not significantly higher, but a little bit higher. So we think that some of the monocyte development is at the expense of some of the T cell development, but not dramatic. And this just illustrates some of our flow analysis, looking at CD56 cells, which are NK cells, which develop in these Hu3GM mice in much higher levels than in the humanized NOG. And as I mentioned, also the CD14 levels, the monocyte macrophages. So again, there's much broader development of human cells in these mice. And the next question we asked is much like Barbara described, are there TAMs and NDSCs in these mice? Because these are important cell types that modulate the effect of immuno-oncology agents. and for reasons I don't have to go into, but they basically suppress the effects of CTLs to kill tumor cells. So we looked at some panel markers, much again like our previous speakers, and looked at in the spleen of these mice at 22 weeks, can we identify MDSCs? And indeed, what we see here is both granulocytic MDSCs and monocytic MDSCs in much higher levels than in humanized NOG mice. So again, these Hu3GM mice are more representative, have a broader range of development of monocytic cells than the NOG mice do. There's also TAMs, tumor-activated macrophages in these mice, a little bit higher levels than the Hu3GM. And obviously, when you implant the tumors, we expect these to be elevated in response to them. That's one of the questions we want to ask in this. So about a year and a half ago, we got a SBIR phase 1 grant on some of these studies. And our partners in this, beyond the NIH, are Champions Oncology, who provides PDX tumors, they have a PDX tumor bank, and ProImmune, which has this kind of unique pentamer assay to look at specific T cell populations. So our partner here is basically involved to see if we can get a specific anti-tumor response in these animals. So this is, and I'll warn you, this is ongoing. I wish I had data as good as our previous speakers, but basically what we're doing is HLA-A2 matching non-small cell lung carcinoma with the donor CD34, doing our pop humanizations and grafting these tumors, and then doing the analysis, doing a treatment phase of Pembro or IPI and ORB together, and then doing an analysis phase where we're using this pentameter technology to look at, can we get a specific anti-tumor response versus just this broad allogeneic response. And some of the markers that we're using are called MAGIA1 for non-small cell lung carcinoma, MART1 for melanoma, and then we have some other markers that we're obviously going to look for in terms of the CTL activation. So again, the question is, can this model actually be used to generate a specific anti-tumor response beyond just the allogeneic response that Brian has shown, in these mice? So in conclusion, we think that the Hu3GM mouse is going to be a preferred model for immuno-oncology. Obviously, I got to show the data now. Hopefully next year I'll be able to show this data. But we think that just the increased kinetics and the long-term engraftment and the humanization in these mice, which we now know at least 26 weeks, and it's fairly stable from the data I showed you. We can also use lower input 34s to humanize these mice, which is important if you're making large cohorts of animals. So we use 10 to the 5th cells. We think we can get away with even half of that. So out of one fetal liver prep, we can make probably up to 70, 80 animals if, all the conditions are right. So that, allows us to increase cohort sizes, and the increased kinetics of humanization also is a time saving. Now that I'm private, everything revolves around making a profit somehow on all this, which is a challenge when you're doing science on your own dime. I think this is part of the equation for us in terms of dipping our toes into the immuno-oncology field. We see development of TAMs and MDSCs in these mice. So we think this is going to be a very valid platform, a preferred platform for testing not only safety but efficacy of these immunotherapies. And again, these mice are also much more amenable to recapitulate AML disease. We've seen evidence that the IL-3 hGM-CSF mice can actually grow out AMLs that do not engraft in NOG mice. So this is also a platform that we're trying to develop in conjunction with big pharma partners. So I thank you. I'll take any questions.